Hi, this is Dr. Ashok, sexologist from International Center of Sexology Research and Development, HANUMAN Junction, Krishna District, Andhra Pradesh, India. Let me explain you how sex drive works. While sex drive in both men and women is controlled by the brain, it is triggered by hormones called androgens, the commonest of which is testosterone. This particular hormone is often referred to as the male sex hormone because it is produced by a man's primary sex organ, the testis, and because it maintains his secondary sexual characteristics. In fact, women also produce testosterone and other androgens. Most of their testosterone is produced in the adrenal glands located on top of the kidneys, but some is also made by the ovaries. Although levels of testosterone are higher in men than in women, this does not mean that men have a higher sex drive. A suitable level of testosterone appropriate for each sex is essential to ensure that a man or a woman has an adequate sex drive. Lower than normal levels will reduce the sex drive in men and women. This may occur, for example, following illness in men or as a consequence of the menopause in some women. In certain cases, a doctor may prescribe testosterone in the form of HRT to a male or female patient to restore his or her flagging libido. Similarly, naturally raised levels of testosterone typically increase sex drive. For example, many women feel sexier around the midpoint of their menstrual cycle, that is about 2 weeks before their period is due, because their testosterone level temporarily increases when ovulation occurs. Male sex drive is thought to reach a peak when men are in their late teens. Women, on the other hand, apparently reach the peak of their sex drive in their late 30s. Thereafter, it levels off and only begins to decline when they reach their 60s. On the surface, these physiological differences would appear unfortunate. While a man's sex drive is waning, his female partner is getting stronger. Of course, the picture is not as simple as this. Libido, as indicated by time taken to get an erection, for example, may decrease in men, but it does not mean that their sexual desire is in steep decline as well. Desire, as mentioned already, is much more complex than sex drive alone. And as a man gets older, his sexual urges often shift from being purely genitally focused to being more sensual and cerebral. As a result, there does not have to be an imbalance in sexual interest between partners of the same age. And a beneficial spin off of the changing nature of sexual desire is that a man's sexual endurance, ability to delay and control ejaculation, this will increase with age, as will a woman's ability to achieve orgasm. Thank you. Your Dr. Ashok.